So in this video on qualitative research, we're going to get past the numbers, past the means, standard deviations, correlations, and all of the statistical procedures that I've talked about in my previous video, and pivot over to qualitative data analysis, which is an important aspect of research, especially if you're a clinician or a coach, kinesiologist, biomechanist. So we'll explore some of the ways that we collect, analyze, and interpret qualitative data. Now, don't get me wrong, I'm all about the numbers. You know me, I like if you're in my research methods courses or viewed any of my lectures, I'm all about calculating means and doing ANOVAs and two-way ANOVAs, and those are obviously very important, especially when you're testing out hypotheses and performing empirical research. But there's only so much that quantitative data can be informative. I mean, these are some of the books that would be short if we base these books purely on quantitative data. Everything Men Need to Know About Women, Popular Lawyers, Career Opportunities for History Majors, and I apologize for you history majors, no offense. But what I'm trying to say here is that getting beyond the numbers, there is a world of information and knowledge that can be gleaned off qualitative analysis. And I don't mean to be anti-numbers here. Again, I'm all about numbers. What I'm trying to emphasize in this video is meaningfulness, either clinical meaningfulness or practical meaningfulness. And the only way that you can get these meaningful information, I shouldn't say the only way, but one of the ways that we can get the meaningfulness from these information is through qualitative analysis. I'll give you a perfect example. If you're a clinician, an athletic trainer, a physical therapist, an OT, one of the first things you do when you encounter an injury or an injured player is you take a history. Right? We call that the subjective part of your evaluation. You ask questions of what they were doing, their pain, their function, along with all the quantitative tests that we do, the field test, the manual muscle test, and things like that. You put all of that together, you get a meaningful evaluation, systematic differential evaluation of that patient or player, and trying to assess, what's wrong with them. Well, the qualitative part of that is that history. So that can be applied in a research setting where we're trying to find a phenomenon or an event that is occurring in a group of patients or group of athletes that may not be accurately captured just using quantitative analysis alone. So qualitative research is based on the knowledge based on the belief that knowledge is constructed from the ongoing interaction between the researcher, the research participants, and the environment in which a phenomenon or event is occurring. It's an attempt by the researchers to make sense of these events, of the phenomena that, like I mentioned earlier, that cannot be easily captured using quantitative data. So qualitative research begins with an assumption and the use of theoretical frameworks that inform the study of research problems that focus on meaning that individuals and groups ascribe to a social or human problem. And in another video, I'll talk about how we can merge the two, quantitative and qualitative analysis, but it helps to briefly go over the differences between quantitative and qualitative analysis here. So this is taken from the Merriam and Tisdale book on qualitative analysis, and if you're taking my research methods course, I have the first chapter of this book available for you to download. And this is table 1.2, which go over or list the characteristic or differences in characteristics between qualitative and quantitative research. I'm not going to go over each one, but just take a look at, for example, the philosophical roots of qualitative versus quantitative. Quantitative is based on the philosophy of positivism, of using empirical data to test out hypotheses that are logically deduced from theories, and you remember this is all about deductive logic, whereas qualitative research, I'm going to talk about this in a sec, is all about constructivism. It's all about constructing theories and patterns based on your observations and the qualitative data that is collected from your research participants. So that is induction, right? That's inductive logic. Data collection could include interviews, so I'll talk about this in a few minutes here, observations and documents that are that are involved in the research process, whereas data collection and quantitative, we use different testing apparatus, right, or systems, or scales, surveys, computers, you name it. And again, the primary mode of analysis, the main difference is that qualitative analysis is based on induction, whereas quantitative analysis is largely based on deduction. Now, it's very important that although I list these, or I didn't list them, but although the book lists these characteristics by qualitative and quantitative to discern the differences between the two, it's very important that it's not a dichotomy. It's not one or the other. There's a lot of overlap here that we see in qualitative and quantitative research. But just to kind of give you an introduction to the world of qualitative research, this table does, I think, a pretty good job of summarizing the differences. Cool. Now, with quantitative analysis, it's all about objectivity. We want to be objective. We want to base our conclusions and our interpretations on the data that is given to us, right? Or that we collect and observe in our sample of data and see if we can extend those results over to the population. Whereas in qualitative data, it's not all about objectivity. In fact, the subjectivity and biases that we bring into the research is actually embraced. We don't want to cover that up. We want to come clean and say we've got a certain biases. We're subjective, and part of the reason why that is important is because you as a researcher, if you're doing a qualitative analysis, you are the instrument. You are the primary tool to collect data whether you're interviewing an athlete or a patient, or or in a focus group, and you're collecting data, and you're trying to glean off knowledge and information based on the questions that you asked in the actual session. So the focus is on the subjective nature of human experiences, because the reality that is constructed from you as a researcher or from the participants is all about that interaction. Whereas in quantitative data, this is information that already exists. This is knowledge that you're making an observation that of a pattern that already is happening or has already happened. Whereas qualitative analysis is all about the interaction. You're trying to capture the experience as constructed or described by the participants that are immersed in that environment. So that is constructivism, and it's the paradigm under which qualitative analysis is performed. So because the researcher, or you as a researcher, is immersed in that research environment, your perspective, your subjectivity and biases is an important attribute of this qualitative analysis. Let's take, for example, the a divorce. I'm actually using an example that's in the book itself. We can define divorce as a separation of two people who were previously married. However, in order to understand what divorce actually means, you as a qualitative researcher assumes that divorce is a socially constructed category, which means different things for different people, and you try to uncover, capture, and bring to light those individual and shared meanings. So in other words, qualitative analysis, qualitative study goes more in depth than a quantitative data analysis would, or qualitative research would. Pain and fatigue. You're an athletic trainer, you're a clinician or a coach that works with athletes, and we try to measure pain and function using different scales, visual analog scales or Likert scales. But I think you and I would agree that those scales do not appropriately or accurately capture the true meaning of pain or fatigue in these athletes. We have to sit down and talk with them and say, okay, describe to me the pain that you're feeling right now after 7 innings of pitching in a baseball game, or the fatigue or the level of fatigue that you're experiencing, or your drop in function. Go in depth. So qualitative analysis goes into the detailed analysis of what that athlete or patient or participant is feeling at that moment while you're immersed in that environment. Cool. So how do we go about performing the qualitative research? With this video, I'm not going to go into full detail as how we go about doing this. However, I'll go over the outlines in which we can take these steps in performing qualitative research. So the first thing is to define the problem, and you define the problem very similar to what we do in quantitative analysis. We base it on a theoretical framework. The theoretical framework is the paradigm or a series of concepts and theories under which your study is performed. In other words, it's the lens through which your research study is performed. So I like using this analogy or this illustration, and this is also from the book, the Marion Tisdale book. Let's just say the theoretical framework is represented by this box. And this is all of the information and background that's available in the literature. So if you've done a literature review before, even just for a quantitative analysis, you've done and defined a theoretical framework. Say you're looking at P&F. That is a study on PNF, proprioceptive neuromuscular facilitation, is performed under the theoretical framework that for example, the antagonist muscle relaxes while the agonist muscle contracts. Just the basic theory behind under which PNF is performed, right? So we look at the body of research that forms the theoretical or defines the theoretical framework. And then we identify gaps in the literature and state the research question or problem that defines the purpose of the study or the hypothesis of the study. So you already know this if you've done quantitative data. So qualitative research is largely based on formulating questions based on this theoretical framework. So we collect data, we do training, we do some pilot work, we select the participants for the study itself, and then we enter the setting, enter the natural setting or environment in which these participants perform, or if it's an athletic performance or in the sports that they're in. Again, the researcher is the main instrument. You as a researcher is the main instrument for the research study. Now there are various methods that are used to collect data, and there are interviews that you can do in an individual or group setting. It could be formal, informal. It could be focus groups. I've done it where I've done individual interviews and I've taken notes. I've used a recorder. If you have an app on your phone, you can use a dictation app or a voice recorder app and just record the interviews, for example. And with these qualitative study, you want to focus on three main things: how people interpret their experiences, construct the worlds and practices that they're in, and what meaning do these people attribute to their experience. You've got to be able to appropriately and sufficiently capture these three main points in a basic qualitative study. A qualitative study, however, does not look into the relationships between variables or the differences between variables. That's what we do in the quantitative sense, right? That's what we do when we're trying to test out a hypothesis in a quantitative analysis that involve independent and dependent variables. That's something different. With qualitative analysis, we're focused on those three main interpretations. So some examples in qualitative research. How do MS-Ken students understand the purpose of education in their lives? What is the purpose of education from the perspective of an athletic trainer? How do baseball players perceive pain and fatigue over the course of a game or season? What mental health challenges do collegiate athletes face in a pandemic? Notice that each one of these questions cannot be accurately or appropriately captured using quantitative techniques, right? How do you answer something like, what is the purpose of education from the perspective of an athletic trainer using quantitative data analysis? You can't, right? This can only be gleaned off a qualitative analysis such as what we're covering in this video. Okay, so let's take a look at some of the procedures involved in qualitative data analysis. These processes of sorting, analyze, and categorizing qualitative data occur during and after data collection. And one of the first steps that we do is to transcribe the interviews that we perform with these individuals, with these participants. So As I mentioned earlier, what I recommend is getting a voice recorder or a recording app on your phone and just set it aside and ask the questions with your interviewees. And after the interview, you can then use a transcription or a dictation app to put everything in writing, put everything into a Word document, for example. So these act as your field notes. And then you can use a computer program, or you can use index cards, but I suggest using a computer program such as InVivo or Microsoft Word and Excel to search and collate and categorize all of the information. Trust me, you're going to get a lot of information from your interviews so that you can begin to glean out patterns and themes that are consistent in your interviews. Now, one quick note about qualitative analysis is that sample size is not as important as quality of data, unlike quantitative data, right? Quantitative data analysis, we're interested in large enough sample size that would give us a good statistical power, 80% or higher. Whereas qualitative data analysis, you want as much information from individuals as opposed to a lot of, just minor details from a lot of participants. So if you're dealing with, say, 5 subjects, 6 subjects, that's okay. We'll go ahead and focus on those individuals and get as much information from each of them as possible. In fact, you'll look at some of the data that's purely on qualitative analysis, and if you're taking my research methods course, I give you an example that was published, I believe, in 2011, and it's only just a few subjects, only a few participants, in which they were able to sort, analyze, categorize, and interpret qualitative data from the interviews that they perform with these selected participants. And so during the data analysis process, there are a number of different techniques that are used to categorize and formulate. Ultimately, what we're trying to do is formulate these patterns and themes that are consistent throughout these interviews and be able to formulate or construct theories that are based off these observations. Remember, this is induction, the process of inductive logic to come up with a theoretical framework or a theory that are largely based on the patterns and themes that are defined in the observations that you made in your interviews. So that is a process known as theory constructions. And some studies attempt to generate theories or use techniques to ground theory from these observations that are based off inductive logic, or the logic of induction. So that forms the basis on which qualitative data analysis is largely performed. So in summary, qualitative research can answer some very important questions, especially if you're a clinician and you want to understand the responses or the perspectives that athletes and patients have to an injury or to a mental health issue, especially if you're viewing this video in 2020. You're dealing with this pandemic, and so there are challenges that athletes and patients that are going when they're in isolation. So qualitative analysis would be highly informative in understanding some of the ways that these athletes and patients respond to the current situation. The research, like anything, requires lots of practice, some training. Again, like quantitative data analysis, I always recommend you doing a pilot study. Actually, I require it, actually, if you're one of my advisees or students. Pay attention to the reliability and validity of your data. It's very important. The interpretations that you make off your qualitative data analysis is only as good as the reliability and validity of the procedures that you use to collect that data. So that way you can arrive at the most appropriate conclusions from your research study.